Good morning, everybody. I think I didn't get to listen to it, but I think morning meeting is over. I'll have to listen to it later. And I have a bunch of information for you. So whoever joins me, I can't tell what that is. It looks like a message. Okay. Hey, David. Good morning. I'm glad you're here. I hope you had a relaxing weekend. It was really pretty outside, even though I didn't go outside hardly at all. But we are going to go over part one of vitamins and minerals. So I think that was maybe what my mom recommended, and I see on there. So I think it'll be interesting for those of you who don't get bored with a lot of vitamin and mineral information, but there's so much of it, it'll probably take this week and next week, okay? So you can take notes, or you can listen to it again, or just try to absorb as much as you can. Hey, Terry. Hi, Mom. So I'm going to just go over the vitamin and minerals that are both considered micronutrients. As you probably know, they're small, nutrients. And we have the macronutrients, of course, which are the protein, fats, and carbs. We're not going to go over that today. Good morning, Terry. Good morning, David. Good morning, Mom. And then just so you know, it might get a little dry. I live for this stuff, though, so I'm sorry if it's dry for you. Hopefully it won't be. Hopefully you'll pick up a few little tidbits. And then I'll have lots more to go over next week. And then we'll do a little bit of strength training because I need it. I should have done some yesterday, but I just really chilled out. Okay, so anyhow, let's get started. Once again, vitamins. Well, first off, they're all critical for survival. Okay, just so you know that. You probably did know that we need the macro, we need the micro, we need all the nutrients we can get to be as physically, emotionally, and mentally sound as possible, okay? And I'll try to give you all the rationale behind things as best as I can. If I forgot something, you can ask a question, and I will get back with you next week as we continue part 2 of vitamins and minerals, okay? So, vitamins are considered organic, okay? That's this vitamin part, and can be broken down by heat, air, or acid, okay? That's the first part. That's the vitamins. The minerals are inorganic. Love those classes. Inorganic and organic chemistry, not really. But minerals are inorganic and maintain the chemical structure, okay? So that's not all that exciting. Don't worry about it. You don't need to know that. But the main thing is the top recommendation would be to get, as you probably know, all your vitamins and minerals through fresh, whole food, okay, within the My Plate, as they changed over the years from the 4 food groups to the pyramid to the My Plate. Now, they mentioned 5 categories. I disagree. I wasn't on this committee. I was on the pyramid committee. So they say 5 categories. I say 6, okay, and I'll tell you why. They put on the plate the fruit portion, the vegetable portion, the protein portion, which could be meat or non-meat, and then they put the dairy portion, which could be a non-dairy type, beverage, if you will, that still provides you with similar nutrients to some extent, which could be your what do you call it? Your oat milk, rice, almond milk, rice milk, soy milk, whatever, that are usually fortified. They're not all fortified with the same thing, though, just so you know. Some have the vitamin D, some don't. They usually have calcium, okay? But they do have different constituents as far as whether they have, how much sodium they have, how much saturated fat, etc., depending on what you choose, how much sugar they have. So you really need to pay attention to your labels and what works for you, okay? What you can tolerate, if you need a A2 milk or a lactate or whatever. Anyhow, but the 6th category they did not mention, and I'll even say 7, really, to be honest with you. 6 is the healthy fats. It's not on the My Plate, so keep that in mind. And those are going to be your avocados, which we've mentioned already, your healthy fats like nuts and seeds and olive oil, avocado oil, sesame oil, things like that. The other one would be water. We need to be hydrated. We have to be hydrated. Water in particular. I just noticed, and this I'm sort of happy about actually, that Coke is getting rid of 200 of their items because of less sales. I feel bad for them, but not really, because these items are not healthy. So this is always my wish anyhow. And I think a little bit of it is because they have so many new water products that are electrolyte waters and, you know, just flavored waters and things that we should drink instead. I'm just all about plain water, okay? And I'm gonna have to grab my water because I'm thirsty already because I didn't grab a water. So anyhow, going on past that, I'm going to start with the names of the water-soluble vitamins, because we have water-soluble vitamins, we have fat-soluble vitamins, okay? There's a big difference in the two. Water-soluble, you pretty much need daily because you are going to urinate that out. And if you take too much, there can be toxicities, less likely. However, you know, you do need those foods daily. And I do take a multivitamin just because it's my insurance policy. Throughout the years, dietitians said no, then they said yes. And, you know, it depends on if you see a different dietitian or doctor or whatever. But I'll just mention vitamin C is the first one, and then we'll go through it. But there can be toxicities to these things. It's not like you should take a major amount of any of these vitamins and think it may not hurt you, because it could if you take them large amounts for too long, okay? And we will go over all of these between this week and next week. So we have thiamine as B1, riboflavin as B2, niacin as B3 in large prescription amounts. That can help with lowering cholesterol and LDLs. It can cause some flushing and itching, but if you do take niacin, that's a prescription form, which you would only get from your doctor, okay? Otherwise, you would just take it as a normal B vitamin, or through food. B5 is pantothenic acid. B2 is pyridoxine. All the B vitamins work together, by the way. So typically, you wouldn't take them as an individual vitamin unless you know that you're low based on your labs, okay? Which I encourage you to get a vitamin lab if you haven't done that. At least once every few years or so, as long as your doctor and your insurance agrees to that. I've had them done, and it's really nice to know if you're within normal limits, and if you're not, which one you're not, okay? If you need a supplementary prescription. All right? Yay! I see people. Okay. Biotin, B7. A lot of people take a lot of biotin for their hair, skin, and nails. That's really controversial. I'm not big on that. I rather take a multi or a B complex. B9 is folic acid. That's extremely important for quite a few people. When we get there, I'll tell you why, if you don't know already. B12 is cobalamin, and that is also extremely important for many, many reasons. And I'll tell you why when we get there, but especially if you're over 50 or if you're having neuropathies or any other problems. But we will go over those. So you probably heard of a lot of those B vitamins. Let's see here. The fat-soluble vitamins, which we'll go over each one individual. That's why I said it's going to be a two-part class, okay? They're better absorbed with healthy fat when you take them. So I usually always take my multivitamin and my calcium and vitamin D with a meal, okay? And I typically eat oatmeal with blueberries and walnuts, so my walnuts are my healthy fat, okay? Yours could be avocado toast, for example, which is a healthy fat on whole grain bread of some sort if you're able to. Or it could be, you know, it doesn't have to be toast. It could be something else. But anyhow, that's stored in the liver and in the fat tissues. So those can build up to be in toxic amounts if you take too much. So keep that in mind. Those are 4 of them, A, D, E, and K. B12 a month ago and my mood improved. Yay! Really great, Terry. And it does. It will improve your mood because that's one of the signs of low B12 and low vitamin D and a couple other B vitamins too, is the mood will be decreased. Sometimes when you take a shot, though, I don't know if they'll give you 2 shots because if you take it under the tongue every single day, 500 micrograms to 1,000, it will be even. Most of my patients in previous job, I would recommend twice a month, every 2 weeks, because it starts, like the graph will wean down if you do it once a month at 1,000 micrograms. So I don't know if your doctor will do that, or it's every 2 weeks, or it's even convenient for you. But usually twice a month is better when you get a shot. If they won't give that to you, it's possible that the last 2 weeks of your month that you might want to take a B12 pill, maybe just 500 micrograms, even every other day, just to keep that B12 even, okay? I'm very familiar with it, and it won't hurt you. Anyway, so let's see. So we got A, D, E, and K, and those, let's see, we'll start out we'll start with vitamin A and just briefly go through that. We all know that our moms, my mom, wanted me to be eating carrots to get my eyesight. And thankfully, thank you, Lord, I have good eyesight. I still don't need glasses at 60 or readers. So that's really wonderful. But that's because there's many, many more foods other than carrots. The leafy greens, all the real orange fruits and vegetables and green ones can all provide vitamin A, okay? Mangoes and sweet potatoes, which I don't like, but there are many, many others, okay? I love spinach and baby greens and things, which, those type of things. But anyway, they do help with vision. They help with fighting infection. It's an antioxidant. It helps with heart health. If you start seeing signs of acne, which maybe even out of your teen years, of course, or dry skin or poor wound healing, it may be attributed to vitamin A. The thing about vitamin A is you don't want just pure vitamin A beyond the 4,000 to 5,000 IUs a day. That can be very detrimental because it is a fat-soluble vitamin, and it can cause birth defects in pregnant women. So we would never give more than that in a prenatal, and even in just for anybody. You usually want the form of beta-carotene, okay? And you don't want excessive beta-carotene in a supplement either. There's been many studies that beta-carotene in excess can cause problems, especially in smokers or previous smokers. So there's a lot of research on that. So the toxicity level would be around the 10,000 IUs. I wouldn't even go there. I wouldn't go past 4,000 to 5,000. Usually 4,000 for women, 5,000 IUs for men. Okay, but that's usually in your standard multivitamin. If you eat lots of greens and fruits and vegetables and things, you usually will be fine. Okay, I just take that multi as a insurance policy for myself, and I make sure it's got USP on there and general manufacturing guidelines, and it's not just some willy-nilly cheapy vitamin. Okay. So that's going to be your vitamin A. Vitamin D3, vitamin E, vitamin K, we'll go through. Another one you do not want to take over and above the vitamin manufacturing guidelines is vitamin E. That's one that I think some people take extra, and you don't want to do that. That also has studies that shows negative outcomes if you take more than the 30 IUs, 15 to 30 IUs that's on your vitamin bottle. So I would typically get that through nuts and seeds and just regular whole grains and things like that. But we'll get there. I'm not going into depth yet. Your non-essentials are going to be biotin, which your body produces. So you typically, when people say they need lots and lots of biotin, because I know people that do that, it's typically not necessary unless you're really malnourished. Vitamin K is also made in the body, okay? There are foods that you can get it from as well, but I'll go into detail into that more in a minute. Okay, so let's start with the water-soluble, which is vitamin C. And there's a lot of controversy about that. I know they have the little packs of 1,000 milligrams of vitamin C that people take, and it's sort of like, I think it gets a little fizzly or whatever. I can't think of the name right now. I don't take it. The recommended daily allowance for vitamin C was upped a while back from 60 milligrams a day to 75 for women, 90 for men, and if you smoke, 120. It's preferable you don't smoke, but that's 75 for women, 90 milligrams for men, 120 milligrams for people who smoke, which hopefully you won't smoke, because the quicker you cut back, the longer your lifespan will be, unless some unusual thing happens separate from smoking, okay? But it does support the immune system. It is something, if you take to an excessive amount, short term, not long term, okay? Tang, okay. Boy, I haven't heard that for a long time. Oh boy, I guess that's for the what is it? The people that go into space. Okay, I don't know if they have a sugar-free one or not, but Tang, okay, you're getting your vitamin C. Just watch the sugar though. I don't know what, I haven't seen that. I didn't even know they sold it still. But typically you only need like a 4 to 6 ounce of orange juice, but an orange is better, okay? Or bananas have vitamin C. I think I have some of the foods here. Peppers, bananas, berries, half a cup of blueberries, for example. I posted that, but it's really, really healthy. Spinach, potatoes, sweet potatoes, anything citrus, and a lot of greens, okay? But they really help with your vision. It helps also prevent the, of course, I had to put the initial, the macular degeneration, which you don't want, okay? I think it's usually when you can see only your peripheral vision, but you can't see straight out. So I don't want that. And I know a neighbor that had that. She could always see me walking the dogs. Used to be a space cadet. Okay. There you go. No wonder. Got to keep with that Tang. All right. But it helps with collagen, which helps keep our skin sort of, little puffy, like, keep that skin and all the tissues nice and young. It helps keep those blood vessels that run through our whole entire body more pliable and, just much better shape than if they get all stiff. Okay, we don't want that because we don't want those plaques and stiff blood vessels. So vitamin C and foods, and if in fact you do drink some juice or Tang or something of that nature, you want to get up to that. For you, Terry, for men, 90 milligrams, okay? So look how much is in your glass of Tang, how many ounces it takes to get it. It also helps to absorb your heme iron, which comes from meat, protein sources in that fashion, or even the non-heme iron, which would be more in vegetarians or people that eat a lot of plant foods. The vitamin C will help absorb that better, okay? If you start having cold symptoms, that's when maybe you want to take that extra vitamin C, okay? But that might be through the cold and flu season, so that could be maybe 2 to 3 months, but not all year, okay? Because it could cause what they call rebound scurvy. That's when people were on the boat way back in the day, and they would get scurvy, which is bleeding gums, loose teeth, sores all over the body called like petechiae, which is little dots. That's not good. So you could have all kinds of things, hair loss, I said the bleeding gums, the non-healing wounds, fatigue. So you really don't want, or a hard time to recover from colds and flus. So you don't want to do that all year round, though. So don't think vitamin C is like your go-to all year. You want vitamin C. You need vitamin C through foods particularly. If it's in your multi, great, okay? That's how I look at it. But I try to get it through food every day, okay? Bananas, apples, oranges, whatever. Oh, Stacy, hey! 6'11", okay, among other supplements. I can tell when I don't take them. You have to watch your sugar intake, of course. Yeah, and if you take a chewable one, Stacy, or anybody else on here, I probably would try not to do that if possible, or brush your teeth, because that ascorbic acid, which is what vitamin C is, can hurt your teeth, and you don't want that. Rebound scurvy, yeah, you don't want that. Yeah, so I probably wouldn't recommend the 611 all year, but maybe during the cold and flu season, okay? And then, of course, if you wear a mask during that time, I think the cold and flus were down because of the pandemic. So I may, of course, I always get my flu shot. And congratulations, Stacy. I saw you got your booster. It boosted me to get my second booster. So anyhow, thanks for joining us too. But anyway, yeah, said that the extra probably is only during that cold and flu season, and then go back to, the 90 milligrams in a multi, unless you take it separate. It might be a 100 milligram tab. That's fine, okay? So let's see. It would be toxic at about 2,000 milligrams a day. You never want to do that, so don't do 2 of those packs a day if you have one of those vitamin C packs. I forget what they're called. It's right on the tip of my tongue. But anyway, that it can get nausea, vomiting, cramping, diarrhea, headache, fatigue. So if any supplement gives you those signs and symptoms, which I'll name several, then you know that's not for you. If you have supplements, be very cautious. Check with your pharmacist with other medications you may take. Don't add more than 1 at a time. Okay, great. So, wonderful, Stacy. So, yeah, stick with your multi, and just in that cold and flu season, take the extra one, okay? So that's perfect. No chewable gummies, perfect. And I'm not crazy about gummies of any kind. They're usually got a lot of sugar in them, and most of the gummies, from my perspective, don't have everything you need in them. If you compare them to a standard vitamin, I usually use capsules that the vitamins are ground, and that way they're easy to swallow, and they break down easier rather than a rock kind of vitamin. But it's what you can afford, okay, and what you can find works, what you can tolerate. I want something that's not going to give me fishy burps from my fish oil, or give me stomach aches, and not going to pass through unabsorbed. So you got to find what works for you. But yeah, so I think I mentioned the foods: fruits, berries, peppers, spinach, potatoes, Brussels. I lean away from potatoes more often just because of the starchy nature of it, okay? But not that I don't eat potatoes, I do, but I keep them, smaller amounts. Alrighty, so thanks for everybody joining me. And then vitamin D3, not D2, okay? D2 is basically a form of vitamin D that's not, so we're changing topics here, so you know. Oh, yeah, hi, Linda. I just saw your picture. David's catching it for me. So that's cholecalciferol. The D2 is a vegetable form. We want the form D3 for our bone health. It helps absorb calcium and retain phosphorus for our bones. It helps control infections, reduces inflammation. It supports immune health. It decreases respiratory infections. It helps with the mood again, like Terry was saying. It helps with bone pain. It decreases respiratory infections. Helps with rickets with children or babies, which happened way back in the day. So most people aren't like extremely deficient, although most of us above the Mason-Dixon line, which if you're in Ohio, you are, usually can't get enough sun because all the rainy days and cloudy days and stuff to get the vitamin D like they said that we do. Because I know after thousands, if not 7,000 or more, 10,000 labs that I've seen, almost everybody's low. Caucasians and dark skin alike, dark skin more so. Basically, you can have the cramps, the bone pain, the rickets, and even some problems with infants that are born if the mother doesn't get enough vitamin D, okay? Possibly, not 100%, but possible type 1 diabetes if the mother's low in vitamin D. That's what they're looking into, but there's not 100% research developed on that, but they've talked about vitamin D, or because of immune system and such. So the other thing, there's not that many foods with vitamin D, let's see, except for fortified milk, maybe fortified eggs, fish with their bones, and mushrooms. And a lot of people don't eat a lot of that. So toxicity would be if you take excessive amounts without a doctor's care, would be nausea, vomiting, decreased appetite, maybe kidney damage. And the foods that would have it that I didn't mention might be salmon, mackerel, which my fiance told me that his mom used to make mackerel cakes instead of salmon cakes. And he said they taste similar. So I thought, oh, wow, I'm going to have to try that to get more vitamin D that way. So that was sort of interesting. Sardines, which I like. And then, of course, the milk, fortified cereal, and possibly the eggs, I think I mentioned. If you get your levels checked, the range of a good vitamin D level is between 30 and 80 milligrams per deciliter. I think mine was 80 at one time, and then the next time was 50, which is still really good. But when the doctor says you're okay at 30, I don't feel real good about that, because that's right next to being low. Under 30 is low. So if you get your labs checked, really, think in terms of you want it around the 50 range, okay, for a normal vitamin D. I always recommend that people take, they say you only need about 800 milligrams or IUs a day, 400 to 800. I disagree. I've never had any patient that I've worked with that only needs 400 to 800. I mean, that's your minimum. I take 3,000 a day. I don't have any of the negative side effects. Like I mentioned, the nausea, the vomiting, decreased appetite, kidney damage. I don't have any of that. I'm fair skin. I don't go in the sun. So that's hardly ever, really. But so I would say check with your doctor, get your labs checked, see what your vitamin D is and what they suggest, what the pharmacists suggest in relation to your medications or any other things. A lot of times you have to go on 50,000 IUs 1 to 2 times a week for 2 to 3 months. Then you're done, and then you need to maintain with usually Caucasians 1,000 to 3,000 dark skin, usually 4,000 to 5,000 IUs a day. So you don't have to listen to me, but I would definitely get it checked and then find out what level works for you to get your lab value to that nice number around 50, okay? Very important. And I wouldn't tell you this if I didn't do it for 10 years, like every day, Monday through Friday, okay? Vitamin E, and like I said, I'm going to make this into 2 talks so you're not bored to death, because there's a lot of vitamins and minerals. Vitamin E, okay. Vitamin E is fat soluble. It's alpha tocopherol. If it ever says DL alpha tocopherol, no, that's the cheap form. Don't use that. I only get alpha tocopherol. I don't get DL. No, bad. And that's an antioxidant, and it fights free radicals. So that's a good thing. You want vitamin E, but you don't want a ton of it. There's been studies that too much is not good. So usually 15 milligrams to 30, or 15 milligrams or 30 IUs, okay? They mark it 2 different ways. So basically that helps. Let's see. Well, check if you're on a blood thinner, because that's another thing. It can be a problem. Just the low amount is fine, but you don't want to get excessive amounts of vitamin E. But basically, they said it can excessive if you go up to 1,000 milligrams. So if 15 milligrams is RDA, you don't want to go to 1,000. So don't take excess vitamin E. I know people that have, and you don't want to do that. Nuts, seeds, pumpkin seeds, peppers, avocado, asparagus, just general foods will do the trick. But it's stored in the fat cells of your body, so that's where it can get to be excessive. It's not true, Mom. We don't live in Florida. They used to say you only need a dime size of your body to be in the sun for 15 minutes, but you might have heard it, but I've seen the labs and I've seen the people, and it's not happening here. It's just not. I've seen the research. If you saw how much research is on vitamin D right now, that would negate your sentence. No offense to you personally. But I've seen like hundreds and hundred pages of research, as well as the labs and the repletion after I've made the recommendations. So when you see that, that'll change your mind, I promise you. Because I have a parathyroid issue, my endocrinologist has went 3,000 to 5,000. Yeah. Okay. trying to afford. Yeah, great, Stacy. Okay, thanks, good. And even without the parathyroid, Stacy, you probably needed it. I'll be honest with you, because almost all my dark-skinned patients and members need that much. Even I do. So I love my mom's comment. That's what they told us in school. But a lot of things they tell you in school, when you come to real life and you work with the patients and the labs and the surgeons, the doctors, you find out everything in school. Some of my professors hadn't worked in the field like forever. So they teach you great stuff, but as you all know, Mom, you went to nursing school, and some of the stuff they taught you, you go and work, and you're like, wow, now I learned the real deal. So, anyway, that's all I got to say about that. So, some of my professors had been teaching the same stuff for 40 years, and now this is me 35, 40 years later, so I got to stay up on the program, Okay, so vitamin K, and I'll stop in about, if I'm not finished. Oh, yeah, I'm almost finished, because I stopped, I think, because I knew that, or I skipped a page, because I think I have 4 pages left, so I'll stop soon, and then give you the rest. The rest of the story is that one gentleman said on that radio show. So vitamin K, I am actually taking vitamin K, and I'll tell you why. First off, it's essential and non-essential, okay? Essential meaning it's made in the gut. There's K1, which is from plants, and that's like kale, spinach, and parsley. Probably some other green vegetables. But there's vitamin K2, which is menaquinone. And the reason I'm doing that, it does help with blood clotting, so you have to be careful if you have a problem with that. But for me, I don't have any kind of problem with that. I have a problem with now osteopenia after taking I think it's going on almost 6 years, and I have a year to year and a half more to take to prevent my breast cancer. So it's broken down my bones in my hip and my back. So I have osteopenia, which could lead to osteoporosis. So I don't want a fracture. So I'm taking MK2 or K2, M7, that's what it is. So it basically helps with the bones. So they're recommending 110 micrograms of K2, and then I'll be 30% less likely to have a bone fracture. So I'm not saying that you all got to take that, but if it's in your multi at 90 micrograms for women, 120 micrograms for men, if you're not one to be able to eat, the plants, or you have any kind of osteopenia or osteoporosis, it's something you might want to check with your doctor, or even if you have cardiac problems, because as you all know, Mom, how you cut back on your calcium, I was told to take 1,200 milligrams of calcium. And in order to take that, I don't want the calcium to get into my bones and cause plaques, but I do want it to get into my bones and stay in my bones and not go into my organs and harden my organs. So it might be a little confusing. It's worth asking your doctor if you're concerned about bone health and you don't want heart problems, okay? Because we do need calcium and phosphorus and magnesium, which I take, but I want to make sure that K2, M7, I'm taking and I talked about that probably a year and a half ago in one of the videos, but I want my calcium to stay in the bones, not in my heart and my kidneys or my liver. So that gets a little complicated, but just to mention it. Okay, 5 more minutes, and then we'll do some stretching and stuff. B6 is pyridoxine. It's a water soluble. It helps with your brain health. It helps with your nervous system. It helps with your immune system. It breaks down carbohydrate, protein, and fat. It works with B9, folate, and B12 to control homocysteine. If you have heard of homocysteine, it's something that can raise heart disease. We don't like homocysteine. We don't want it. B6 helps to regulate that, okay, and get the homocysteine down. I remember working in cardiac health, and I was always talking about homocysteine, and we don't want that. So the B vitamins really work together and really help keep that under control. It also can help with PMS, which some of you probably don't have to worry about. I don't. It can help with morning sickness. I don't think any of you all need to worry about that, but if you have any friends that do, then the prenatal will have that in it. And the RDA, recommended daily allowance, is 1.3 milligrams, so that should be what's in your multivitamin. The only people that would have a problem typically with B6 would be people with celiac disease, and they would be on a gluten-free diet, ulcerative colitis, not irritable bowel syndrome, ulcerative colitis, totally different. Kidney disease, I can't read my own writing. What was the other one here? I can't read it, sorry. Anyway, the deficiencies could be depression, confusion, low energy, and if you were to take greater than 1,000 milligrams, they're only saying take 1.3, but you could have nausea, ataxia, where you're having trouble with balance, and also neuropathies, which you could have in your hands or your feet. So that's something that you just want to get that RDA of 1.3, which I should have the foods. Yeah, I do. The foods would be tuna, salmon, oranges, bananas, chickpeas, leafy greens, okay? So they're just normal foods. So you don't necessarily need a multi. It's just if you're not able to eat a well-balanced diet, that would be in order, okay? B12, this is a biggie. I said I got a few more minutes. So I'm just going to do 2 more, and then we'll stop. And then I think I got 20 more for next week. So you asked for it. You get it. B6 foods, B12 is needed for red blood formation, okay? So this would not be the regular red blood cell anemia. It would be pernicious anemia, and the RDA is 2.4 milligrams or 500 to 1,000 micrograms, okay? So that's like I think Terry had talked about with his shot, okay? Or you could do it sublingual under the tongue at 500 to 1,000 micrograms daily. If you're over 50, if you're on antacids, if you have reflux, if you have neuropathies that could potentially be reversed, it helps support memory. If you're a vegan and you don't eat any meat or dairy or eggs or anything, you definitely need B12. Let's see. If you have poor memory, confusion, weakness, loss of appetite, balance problems, the foods that would typically have it would be chicken, fish, pork, nutritional yeast, which I'm not up for. But anyway, those would all provide you with the B12 you need. It's a really, really important nutrient, okay? I had many, many people low in B12. So, and anybody that has had bariatric surgery, a sleeve gastrectomy, or a gastric bypass, the gold standard, they would definitely need B12 every day, okay? Just automatically, because their stomach has been turned into a banana or a little golf ball that turns maybe into a baseball, and they don't have the ability to absorb the B12 like we normally would. So definitely any bariatric patients, okay? I don't think balloon or lap band do from my memory, but it doesn't hurt to get your labs checked, okay? One more, and if there's questions, please feel free to stop me. I'm going to go one more, and then we're going to take a little break and stretch. Folate, B9, versus folic acid. Similar, a little bit different version. The folic acid is better absorbed, just so you know. They're essential to provide for preventing birth defects. So this is very, very essential for anybody that you know that's pregnant, wants to get pregnant, okay? They need double the amount. I like having double the amount anyway. It was once suggested 400 micrograms, now it's 800. And it can even be a little bit more if you're pregnant. Depends on your labs and your OB doctor. And that helps with your red blood cells, healthy cell growth. And once again, if you're at risk if you have, once again, decreased stomach acid, digestive disorders, and if you're an alcoholic. we always make sure and give that Raleigh pack for alcoholics when they come in, which has the folate and some other B vitamins. And then if you have any kind of genetic disposition towards not being able to use folate, and I want to say it's MFTH, I can't remember, or I think that's it, but it's a genetic trait where you need to take a different form of folate. So I'm not going to get into that right now. And then if it's higher than 1,000 micrograms, it can mask a B12 deficiency. Keep that in mind. Seeds, nuts, eggs, fruits, vegetables all have it. Okay? So typically you shouldn't be low, but it's worth getting those vitamins checked. Okay? Because folate is really, really important. That also helps with heart health, as far as I can remember, as well as many, many other things. Folate's just really, really important. And the next one's biotin, but I'm going to go over that next time because there's a lot of controversy about biotin. And we do need it, but not to the excess that a lot of people take it. And I know people have it in their shampoo and all kinds of products. So I'm going to stop there, but hopefully that gave you some details about some vitamins and minerals. And I still have probably 15 to 20 to go. So that's why I'm going to make it a part 2, vitamins and minerals. And I think it's very exciting. So, and that's just the micronutrients. We didn't even get into the macronutrients yet. So, anyhow, I'm going to put the stand up and just do a little bit of strength training with the 15 minutes we got. I don't know if Jenny's on there or not. I can't tell because I know she likes to do that. And I think her foot's better. I didn't wear any earrings or anything. I'm sort of just winging it. Okay, let's see here. Move this over. I had my weight fall on my toe today. Don't do that. Don't let your weights fall on your toe. That hurts. Okay. So, does anybody take multivitamins or think they might need to because they're not eating enough variety right now with the cost of food? Where'd my other weight go? Rolled away. Oh, there it is. I'm just wondering. Something you learned today you might use? Or does everybody know it all? Well, let's just do the sun salute since I see a little bit of sun. I'm going to move your words for a second, then I'll move them back and check. But, okay. We'll just sort of stretch. Breathe in through the nose. Breathe out through the mouth. Boy, I cut my own bangs. My hair appointment's not till next week. Oh, pretty bad. I do still have my hair, though. My bangs are all goofy. Okay. Just sort of stretch it out. One exciting thing, Ken and I went to the Smile Direct Club because my top and bottom teeth are getting crooked, and his have always been crooked, so we're getting like the cheaper version of Invisalign, but it has a great rating, so we're both going to get our teeth straight together. I know you think mine might be straight, but they're not. So we were really excited to get our consultation, and we're saving like a ton of money, a tip for one. And he's really excited to get straight teeth. So that's the news of the weekend. Okay, just get everything else stretched out. If you have weights, great. If you don't, just use your own body weight. And we'll just do the curls, if you will. I look like a boy here. Okay. Should be counting, sorry. All right, I'll count next time. Okay. So So let's just go up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. 1. You can do it light weights or a little bit heavy or whatever. 2, 3. I might have been off. 4, 5, 6, 7, 8, 9, 10. Okay. All right. Now we'll do the back of the arm there, or when you wave, it jiggles. 2, 3, 4, 5, 6, 7. Tummy's in. 8, and breathe. 9, 10. Back straight. Best as you can. 1, 2, 3, 4, 5, 6. You can count with me. 7, 8, 9, 10. Okay, good. Very good, very good. Okay, now I'll probably need to move back a little bit. I don't know if I can though. Didn't set it up very good. Okay, we'll just do the we must do more. We must do more. Okay, we must. I changed the words. Do more. Okay, so you feel that? I can feel it in my arms, in my shoulders, sort of my upper chest. Okay, all right. Let's see what else. We can do the little isometric. Put it in a box. Hopefully nobody had storms last night. If we did, I didn't know about it. I got my garden together in the box. Belinda's still on there. I can't tell, but I got it like yours. It's really pretty. Okay. All right. Now let's just get our hands warm. It's a little chilly in here, actually. It was pretty warm on the weekend, though. That was nice. Do that. And then put it on your eyes. Oh boy. I put some mascara on. It's going to be all smashed. Just breathe. Through your nose and out. Through your mouth. Through your nose and out through your mouth. Okay. Put our hands behind our head. And sort of clasp our hands together and put your elbows straight back. We want to have the best form as we can. And then we can just sort of whittle our waist a little. Just slowly. Whittle our waist. Now, you know, if you're trying to watch your weight or if you're trying to get more protein in, I know I mentioned those Orgain protein drinks. Now, there's all kinds of other drinks like Glucerna and Boost and, oh my gosh, there's lots of protein drinks out there. So you could always use that as a meal replacement or as a snack. And that'll help you feel fuller. If you're having trouble with your bowels, you could use Metamucil. That'll help with your blood sugars. It'll help with your bowels. It'll help make you fuller. I've been using the ginger capsules for a little bit of nausea. It's been helping in acid indigestion. I haven't had to use any antacids or anything. Just using a ginger capsule. Now, check with your doctor or pharmacist if there's any interactions on anything I talk about. Always check. They can look it up in the computer for you. You don't want any interactions with anything you're taking. But I like to mention things just in case it might be helpful. Okay? The brat diet, if you have diarrhea, banana, white rice, applesauce, white toast, or maybe a little bit of decaf tea or chamomile tea. You know, there's times of stress, times when regular foods just aren't working for you. Maybe a little saltine cracker as opposed to a whole wheat product. Okay. You can use a Calm app. You can use the Dare app. You could just Google some calm music. Okay. We'll do circles. Circle, 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 circle. Put on some calm music if you need to take a little nap, you didn't get enough sleep, you want to try to get at least 7 hours sleep a day. If you don't, take a little 20 to 40 minute nap. I did that yesterday and I was really refreshed. You know, just a nice calm Sunday. So, take advantage. Okay. How's everybody feeling? Any questions? How much protein in supplements? Okay. They vary from 10 to 20 to 30. Don't take more than 30 at a time. If you add milk, then only use one with 10 or 20 in it. Okay, Mom? So watch. If it says 2 scoops, usually only use 1 scoop. Because a lot of times they'll say 2 scoops is like 52 grams. Don't do that. You're not going to absorb it. It's going to tax your kidneys. Only use no more than 30 grams. So if it's a 20 gram scoop and you do add 8 ounces of milk or lactate or whatever you use. Now, of course, almond milk only is 1 gram, so you don't have to worry about it. It just gives you the calcium, but no more than 30 grams at a time. And that's even true with meats, because your meat, 3 ounces, is usually anywhere from 21 to 28 grams, depending on what kind of meat. If it's 4 ounces, it usually shrinks down to 3 ounces unless it's really, really lean, okay? So that's what I'm going to recommend if you're going to use a protein bar, protein drink, a protein food. You know, try to keep it to no bigger than the size of a woman's palm or a deck of cards or an old cassette thing, which most people don't have. I still have some. But that's what you want to do. Unless you have kidney problems and you're not on dialysis, then you want to keep your protein much lower. They'll tell you how much. It could be 10, 20, 30 grams, 40 grams. But otherwise, 45 to 60 for women, 70 to 80 for men, unless they tell you lower. Always check with your doctor to see what your kidneys are doing or your liver's doing. But you need to make sure you get that water too. So if you're getting in that protein, you got to stay hydrated. You can't be taking 80 grams of protein and only 4 cups of water. It's not going to work. Same with the fiber. If you're getting your fiber up to the 20 to 25 grams for women and 30 to 38 grams or 35 to 38 grams for men, you need the fiber. You're going to be constipated. So to keep your kidneys in good health, you need water. To keep your fiber and your bowels moving smoothly, you need the water as well. Okay? Does that help? I hope. Water, water, water. Now, of course, there's fluids in your fruits and your vegetables. So don't count on that, but you will get it. You know, things like berries and watermelon and cantaloupes and things like that. Okay? So you do get fluids, but we only count it if you're, you know, on a renal diet. But otherwise, you know, you just count your fluids from decaffeinated products primarily, and from water, and any kind of fluids that aren't, you know, sugar laden. Okay, and if you can handle caffeine, and even if you can't handle caffeine, they're basically saying that tea and coffee, 1.5 to 3.5 cups a day, for those that can handle it and tolerate it, doesn't mess with your medicine, can be very helpful for most people. That's the latest research. So that's just something to think about. And they do have, I know the No Fun Joe is on Amazon, and that's water infused decaf, and I've used that, and it tastes really good. So that way it's not chemically decaffeinated. So just something to think about. Anyway, it's getting close to that time. Does anybody want to ask any more questions? And are you okay with me going over the last 20 vitamins and minerals? I think it's going to be primarily vitamins, more of the B vitamins, which are really important. Is everybody good with that? I might do a few little yoga things. I'll plan for that more because I'll have all my vitamins all written out. Yes? No? I know you probably didn't memorize all those. Yes, I got somebody answering me. Good. Okay, thanks. I appreciate the cooperation. And thanks for everybody who's here. Thanks, Stacy. Congratulations on your wedding. I know it's been a while, but maybe it's anniversary, I think, by now. The year has gone so fast, I can't even believe it. But anyway, I've got all kinds of things to do, so I'm gonna a little bit of wash and a lot of reading and studying and stuff. You probably don't know why, but I don't know, where's my book? I've got a whole book to read to stay on top of my registration as a dietitian. So I try to keep on top of this stuff for you guys. You know that, don't you? I'm not just a schluff. So thanks, everybody. Appreciate you sticking around, and hopefully you got a few pointers. You can always come back, and if you need me to send you... no, I don't want that. These, what do you call it? Marketers. I don't know how they get my number. Anyhow, I will be back with you on Friday, and if you want something special to eat, let me know. I know Ken wants me to make scallops, so I don't know if that'll be this week or not, but that sounds like something to do in the very near future. So I will talk to you later. Have a nice day. See if you can get a little walk. You want to get a little aerobic activity in. The strength training's good. We need to do a little more of that too. I know I didn't do enough, so at least strength training twice a week and a little bit of walking every day, okay? At least 15-20 minutes around the house or outside, okay? All right. Thanks. Have a great day. Bye. Okay, good. Thanks, Terry. Thanks, David.